60 Minutes Overtime.
The blood pressure's going down a little bit, so if you could leave it fed up.
The hospital staff that we worked with, they were really keen on helping us because I think they also want the public to know what's happening inside. My name is Maria Gavrilovich. I'm a producer at 60 Minutes, and I worked on a piece called The Epicenter, which is about the New York hospitals as they're dealing with the pandemic right now. Alex Ortiz is my co-producer at 60 Minutes, and we reported on this story together. New York City has become the epicenter of this disease in the United States. And just a couple of days ago, we learned the United States now has more cases of coronavirus than any other country. We wanted to know what was happening on the front lines and what was happening in the hospitals. This story was challenging because we couldn't go and meet the doctors and the medical staff face to face, which is what we generally do before we interview somebody on camera. They were really busy. They were even too busy to have telephone calls. And we can't go into the hospitals.
Diabetes, 3 liters this morning.
But we were able to find hospital staff that shot video for us and shared that footage with us. In addition to the editorial sort of challenges, we had to worry about our own health and safety and the health and safety of our crew. One of the hospitals where we filmed is Bellevue Hospital in New York. It's the biggest public hospital in the city. It's known for dealing with really complicated cases. They actually treated the first Ebola patient. We talked to Dr. Amit Upal, who is known for his work with the Ebola patient. He is now the head of critical care at Bellevue Hospital. He's really on the front line of dealing with the coronavirus.
What's surprising you about this?
I think the sheer volume of the patients that we're seeing and how rapidly they deteriorate is not what we're used to with other conditions similar to this.
When you say patients are deteriorating rapidly, what do you mean by that?
What I mean is patients coming in with moderate symptoms, cough and shortness of breath, and within the course of a few hours, some of those patients are on life support. And that's really hard to watch, just from a human standpoint, to see someone get so sick so quick. And right now, that's a very common story that we're seeing.
I think, going into the story, you sort of think doctors and nurses are used to this. They do this kind of thing every day. And you would think that they would be unaffected in a way, but they're not. And every single one of the physicians and nurses that we talk to, not just for our piece, but over the course of our reporting, are dedicated and really personally involved in the care of their patients.
Are these all older patients?
No, not at all. And I think the public needs to know that. This is not something that only elderly patients need to worry about. We are seeing young patients from all walks of life who are suffering severe complications.
We hear a lot about the ventilators. Help me understand how it helps the patient.
Sure. So these patients are coming in with severe inflammation in their lungs, and it makes it very difficult for them to oxygenate their blood. Their lungs become very stiff and difficult to distend, which makes it hard for the patient to breathe on their own. So a ventilator is a machine that will assist the patient with their breathing and deliver very high concentrations of oxygen. And we see a ventilator as a bridge to keep a patient alive until the disease starts to resolve. And so in these specific patients that are ending up in the ICU, it's a key element to their survival. If we can provide them with a ventilator, we've got a real chance at helping them survive.
It's truly the difference between life and death.
Absolutely, yes.
It's remarkable. The medical staff is they're really, the doctors and the nurses in this country really are the unsung heroes. I think that they want the public to know what's happening inside, not just because they want to share their stories, but also to help teach the public why they need to take this disease seriously and the precaution that the government and others have put in place seriously.